Open up our doors and come on in. So as you enter the CDP, you're coming into the module area. We'll start with your right, which is where we have a nice bathroom to allow people to give specimen samples, do all kinds of testing if necessary, depending on what they're here for. And then that works out through a specimen pass-through window into the lab area. What's cool about this lab area is it is full functioning, I think hospital grade lab. So all of the blood analyzers and various different testing equipment that you would find in a hospital, we have in here available for on-site use, including some refrigerators, sinks, all the things you can imagine all in one place. We have a small area that can be reconfigured based on the needs of the end user. In this case, they're using it as a small infusion chair area, a small room. It could also be a waiting area. It could be various configurations like that. But like I said, right here, you can see it's an infusion chair and all of the support equipment necessary for those types of procedures. And then as you come around, you can even see, looking back this direction, they have their own TV with telehealth window, all of the standard features you would expect in a modern infusion clinic. We'll come back. Now we're entering into the module area that we talked about earlier. So you can see here, again, in this case, it's not imaging, but it's an additional infusion area. This one's a little bit larger, so it's for more specialized cases. Lots of cool different features in here. First and foremost, we have the infusion chair, very comfortable, modern aesthetic to make a patient feel more at home. So when we talked with and did user experience surveys and trying to understand what people look for when they come to a clinic, we got two different buckets of feedback. One was warm, homey, like make me feel comfortable like I'm at my house, right? And then the other bucket that we got from the same people were clean and sterile, bright and white. So you can imagine those are two different ends of the spectrum. So we worked really hard to try to morph and bring those two things together to give them that warm, homey, couch-like experience, but still having no question that this is a sterile, safe place to receive treatment. So in addition to that, we have obviously two different screens in this area. One is used primarily for the patient, so they have the ability to watch whatever entertainment they're wanting, along with having telehealth functionality, whereas the clinician has access to another screen so they can monitor vitals and see what's going on with the patient there. And then those can be switched as necessary. We also have a hospital-grade medicine dispenser right here, so that is a computer-controlled lockbox that has various medications in it so that we can control substances and having those passed out. In addition to that, the only other features that I'd like to kind of highlight are that both spaces, while independent and separate, are both controllable from one space or the other space, along with also having the ability to have their own air conditioning in each area. So for example, there's an air conditioning in the hub area, there's an air conditioning in the module area. I'll introduce you to Raj here in a minute and he'll go over some more of those features, but just as an example, the patient might be sitting here with the tablet that they can use for their own entertainment. They can watch something on the tablet, they could watch something on this screen. If they decide it's a little bright in here, they can turn the lights down from the tablet. If they think it's a little cold, they can adjust the temperature. They have complete control of their environment to give them the most comfortable experience they can have. So with that, I'm going to hand it over to Raj and he's going to dive in a little bit deeper with some of our technical features.